Located in the upper jaw, the maxilla forms the foundation of the facial skeleton. It articulates with the frontal, nasal, zygomatic, and palatine bones. The nasal bones form the bridge of the nose. They articulate with the frontal bone superiorly and the maxilla laterally. Their main function is to support the nasal cavity and provide structural integrity to the midface. Zygomatic bones, also known as the cheekbones, contribute to the prominence of the cheeks. They articulate with the frontal, temporal, and maxilla-bones. The lacrimal bones are delicate thin bones located on the inner aspect of the eye sockets. They house the lacrimal sac and provide support to the tear ducts. These bones articulate with the frontal, ethmoid, and maxilla-bones. The palatine bones form the posterior part of the hard palate, contributing to the roof of the mouth. They also participate in the formation of the lateral walls of the nasal cavity. These bones articulate with the maxilla, sphenoid, and other cranial bones. The mandible, also known as the lower jaw, is the largest and strongest facial bone. It consists of a body and two vertical ramus on each side. The mandible articulates with the temporal bones at the temporomandibular joint, allowing for movements during chewing and speaking. The temporal bones are located on the sides and base of the skull. They house important structures such as the middle and inner ear. The parietal bones form the sides and roof of the skull. They articulate with each other at the sagittal suture and with the frontal, temporal, and occipital bones. These bones provide protection to the brain and contribute to the skull's overall strength. The occipital bone forms the back of the skull and the base of the cranium. It articulates with the parietal, temporal, and sphenoid bones. The frontal bones make up the forehead and the superior part of the orbit. They articulate with the parietal, nasal, and ethmoid bones. The vomer is a thin, flat bone located in the nasal cavity. It forms the inferior part of the nasal septum, dividing the nasal cavity into left and right sides. The inferior nasal conchae are thin scroll-like bones located on the lateral walls of the nasal cavity. They help increase the surface area of the nasal cavity, promoting air turbulence and assisting in warming and humidifying inhaled air. The ethmoid bone is located between the orbital and nasal cavities. It consists of a horizontal cribriform plate, perpendicular plate, and labyrinth. The ethmoid bone forms parts of the nasal septum, orbital walls, and contributes to the sense of smell. The sphenoid bone is a complex bone situated at the base of the skull. It houses the pituitary gland, forms part of the orbit, and contributes to the cranial floor.